We're going to clean the area with some antiseptic. I'm going to start just right around the orange line, and we're just going to do a ring block all the way around. And I'm going to use about 4 of these. So typically 1, 2, 3, 4. All right, Carson, you ready? It's going to sting just a little bit, okay? You hang on with me there just a minute. And just all the way around, right above. Just going to back that right back up. Okay, turn your head right there. Just relax. So I'll give him a couple more minutes here to get good and numb. And this is the PPP, platelet poor plasma. Okay, we have about 16 cc's of that. This is the PRP, platelet-rich plasma, and to this we're going to mix in 2 cc's of exosomes for his hair. So we will end up with about 12 cc's of PRP and exosomes, which I will inject in his hair, concentrating on this area, but then also bringing it back through here to help him for future growth. So we're going to start injecting Carson. We're going to start right here. I'm going to stay just a little bit above the area where we numbed, and the area of his concern is this area right through here. You might feel a little bit of pressure, Carson, and I'm just doing little aliquots, like 1/10 of a cc, all the way across. How are you doing, Carson? How much pain are you in, sir?
None.
None. And I'm going to start here again and go all the way across, and just about 1/10 of a cc with each little injection. And again, about 1/2 inch back, 1/10 of a cc. So you want to make about 10 injections across. And we went back to here on Carson, okay? So I'm going to make one more pass, and then I'm going to start at the front and go over it again for him. Carson, how are you doing, sir?
Good.
Are you feeling any discomfort or pain?
No.
No. So we're going to start back at the front again. Areas of concern for him were this area here. So we're going to concentrate and make sure that we get that and help rejuvenate that. And again, I'm going to work on this side because this was another area of concern for him. And notice he's having very little bleeding. And I'm just going back over those same areas here for Carson, making sure that we hit everything that's concerning to him. So next I'm going to take the Rubella pen, the settings. I'm going to do about 0.25, and I'm just going to do a very light stamp over the area. And I'm going to use the PPP, this is his PPP here. Again, it's platelet poor plasma, and I'm going to put just a tiny little bit on here, and then I'm going to start rubbing it in. Get it all through his hair. Then I'm going to take the pen, and we're going to do just light stamps. I'm not pressing, I'm just stamping. And then I'm just going to follow the little rows that I made with the injections. And then to turn it off, you just simply hold down the top button and it shuts it off. Then we're going to take the rest of the PPP, and I'm going to put it on here, and it's acting like a little Band-Aid to seal up all those little holes that we just created. Okay, so that's that. Now I'm going to take this and I'm going to just wipe off the excess.
So I can shampoo tomorrow then? Like
Tomorrow?
after 24 hours?
Yes, tomorrow will be fine. So when you get home today, what you can do if you want, I prefer that you just, you can rinse off, because we put a lot of stuff on your head. You can rinse it off with just some cool water and just pat it dry.
Okay.
If it's bugging you, you can do that, but I wouldn't use any shampoo until tomorrow.
Gotcha.
Okay? Any other questions?
That should be good.